Hello, I'm Dr Pratik Choudhary and welcome to this topic where I'll be talking about how we define hypoglycemia and impaired awareness of hypoglycemia using continuous glucose monitoring. These are my disclosures. By the end of this topic, you should be able to understand the definitions of hypoglycemia and how we define it using continuous glucose monitoring, and also how we use CGM to define and interpret impaired awareness of hypoglycemia. So with the advent of continuous glucose monitoring, instead of getting just 3 or 4 readings through the day, we're getting almost 300 readings in some cases through the course of the day. And that's prompted a change in our language from targeting HbA1c to targeting what we're now calling time in range. A lot of international guidelines have set that time in range as between 4 at the bottom end and 10 millimoles at the top end. And a lot of what we try to achieve with continuous glucose monitoring is trying to keep your blood glucose in that middle lane between 4 and 10 millimoles per litre. Now, of course, it's not possible to do that all the time. And you can see from this example, it's normal to have fluctuations of blood glucose as you eat and correct the glucose and maybe have some hypoglycemia. In this case, you can see right there overnight and a little bit later on in the day. The international consensus when you look at the downloads for CGM, you can see there on the left, this particular patient is spending about 37% of their time over 10, 50% of their time between 4 and 10, 9% between 3 and 4, and then 4% below 4. So let's just think about what those different time in ranges mean and how they relate back to the HbA1c levels that we're used to talking about. So when the international group of experts sat together, they've looked at the data that relates HbA1c and time in range. And so our target for time in range, time between 4 and 10, is about 70% of the time. And that matches up in the data with an HbA1c of 6.5%, which is where we trying to aim for. If you take that down, an HbA1c of 7% or 53 millimoles per mole is equivalent to about 60 or 65% time in range. And an HbA1c of 8% or 64 millimoles per mole is equivalent to about 50% time in range. As you can see in the second column there, if you're in people who are older, maybe at higher risk of harm if they have hypoglycemia, we think it's reasonable and acceptable to have a slightly lower target range for time in range of 50%, but we want to minimize that time in red, the time in hypoglycemia. If you look at that bottom red part in the first column there, we think it's acceptable, it's okay if you've got up to 4% of time below 4, but we're trying to minimize the time below 3 millimoles per litre down below 1%, because that's the level below which people come to harm. So let's just go through the definitions of hypoglycemia. A couple of years ago, a group of experts called the International Hypoglycemia Study Group came together to try and work out what the right levels of definition of hypoglycemia should be by reviewing a lot of the data on hypoglycemia. We've redefined the glucose level of 3.9 as an alert value. That's because readings below this are quite common in people with and without diabetes. And actually at that level, there's no particular harm to anyone. But especially if you're using continuous glucose monitoring, where we know there's a lag between your sensor glucose and your real blood glucose, it's important to label that as an alert value, because when your sensor is reading 3.9 or just below 4, your real glucose in your blood could be closer to 3. So that value of 3.9 millimoles per litre is called an alert value because that's the level at which we really want you to take some action to prevent your glucose going lower. And even if you're reading that sort of level, you might actually be at a lower level. The next category is serious hypoglycemia, and that's at any glucose below 3 millimoles per litre. And that's because if you take people with diabetes or even those without diabetes, that's the level below which your brain function starts to slow down. Even though you might not feel it, if you take people into the lab, take the glucose below 3, we know that reaction times slow down. You start feeling confused, you start performing less. And a repeated exposure to glucose levels below 3 can affect your ability to recognize hypoglycemia. So these are the events we really want to minimize, and that's why we're trying to keep these below 1%. And finally, we have the events that we hope no one experiences, and these are serious or severe hypoglycemia. So severe hypoglycemia is when your blood glucose has been low for so long that it's affected your brain's ability to function, and you actually need someone, you either lose consciousness or you need someone else to help you out and restore your blood glucose back to normal. Now these definitions are based on single values, but of course with continuous glucose monitoring you not only have the absolute value but also duration with it. And of course if blood glucose is just dipping along the line, it's not causing multiple episodes of hypoglycemia. And so when the consensus group got together, they've said for an episode to be called hypoglycemia, you have to be below that threshold of 3 millimoles per litre for at least 15 minutes. With CGM, particularly overnight, we see quite often quite long periods of hypoglycemia. And there's some evidence to say that episodes more than 2 hours might cause some harm. And that's why there's a new category of CGM hypoglycemia called prolonged hypoglycemia, which is readings below 3 millimoles for at least 2 hours. When we think about hypoglycemia, and in particular when you're first starting using CGM, the data that you'll get the most of that you never had before was overnight glucose. Now this is just a trace from a CGM system of someone without diabetes, me. And what I want to show you is that even people without diabetes can have prolonged periods, particularly overnight, with pretty low sensor glucose readings. You can see there on the top day, my glucose was measured at 2.3 millimoles per litre by the sensor. And so part of the point of this slide, in a sense, is to say, while we know that nocturnal hypoglycemia is unpleasant, and in severe cases can cause harm, we also know that people without diabetes have this commonly, and that actually if we used a blinded CGM across a large proportion of people, lots of people have these blind, asymptomatic long nighttime hypos and often don't seem to recognize that in the morning. Certainly a recent study showed people reported a similar mood, similar well-being on nights with and without these episodes. It's only when the glucose goes down enough to wake you up that it seems to have an impact on the way you feel. So I know a lot of people get really scared by seeing low glucose overnight, and I think we still need to understand what those low glucose readings really mean and which ones of those are harmful. And so when you first start using CGM, you'll obviously see a lot more data than you're used to. And in particular, you'll see a lot more hypoglycemia than you're used to. So if we look at data from large numbers of patients who are doing reasonably well with their HbA1c, we feel that on average, the data says they have between 5 and 6 episodes of low sensor glucose. That is, if I say between 2.5 to 4 millimoles per litre per week. If we put blinded sensors on people that just measured the glucose but didn't give the patient an alert or an alarm, we would find that they would be below 3 millimoles per litre maybe once or twice a month for long periods overnight. In some people, this can be even more frequent. And even in people without diabetes, as I showed you in the previous slide, people can have nights where the glucose is below 3 for the whole night. So these low glucose events aren't particularly uncommon and may or may not be as harmful as we thought them to be. In fact, in a recent Danish study, when they took people who were classified as being able to recognize readings below 3 quite well, 60% of these low sensor glucose events were asymptomatic and did not affect how these persons felt or functioned. So we've got to tread a balance between saying this time below 3 is harmful and something we want to avoid, and balance that out with, well, it might happen, and if it happens, it's not particularly harmful. The commonest thing I hear in clinic is, oh, if I have a low glucose, will I wake up? And I think the data says that in the vast majority of cases, yes. So let's think about, when is hypoglycemia too much? When should we start getting worried about hypoglycemia? Because of course, any episode of hypoglycemia, we understand, can cause problems for you, can cause embarrassment, inconvenience, and of course we all hear of events and people where hypoglycemia causes much further harm. All the international guidelines suggest that we want to try and keep the time below 4 less than 4% and the time below 3 at less than 1%. That's what we're aiming for, but if your time below 4 is somewhere between 5 and 10%, that's probably par for the course. We should be looking at trying to work out how we can reduce that, but it's probably not a cause for concern. If your time below 4 is over 10% and your time below 3 is over 5%, I think that is probably too much. We should be looking at what's leading to those episodes, what's causing them, and how we can work to reduce that, and what treatments you need, what further technology you need, what further advice you need to reduce that. NICE have defined problematic hypoglycemia in a slightly different way. They've said this is loss of awareness, which means that when your blood glucose is dropping below 3, you're more likely not to recognize it than you were to recognize it. It's important to remember that every person feels hypoglycemia at a different sort of level, but if you're consistently not feeling anything when you're going below 3, then we will say that is an impaired awareness of hypoglycemia. Problematic hypoglycemia is also having had more than one episode of severe hypoglycemia, which needs someone else to treat you or results in loss of consciousness in a year. And it's also recognized as if you're getting repeated, unpredictable hypoglycemia that's having a real impact on your quality of life, then NICE recognizes that as problematic hypoglycemia. So I hope you enjoyed that topic, and by the end of this, you should be able to define hypoglycemia using continuous glucose monitoring, and also define impaired awareness of hypoglycemia and how CGM affects that. I hope you enjoyed the topic, and we'll go through the other topics in this module.